So they come in with like a weird habit that is a sign that there's something out of balance. And it could be their neck. It's not always their jaw, but it also could be their tongue or how they breathe or how they swallow. There's different, like when your tongue is where it should be, which is on the roof of your mouth. So if you put your kind of normal neutral posture for your jaw and tongue would be your lips are together. Your tongue is on the roof of your mouth, not pushing on your teeth, but just behind your teeth. And your teeth are just slightly apart.
Welcome back, friends, to the Erie Wellness Podcast, where we explore a wide range of health and wellness topics, highlight the incredible local professionals right here in our community, and encourage you to advocate for your own health and well-being. This episode is part 2 of a special series featuring sisters Dr. Heather Stamm and Dr. Chrissy Stamm. In our last episode, we explored airway-focused dentistry, sleep, and oral health with Dr. Heather. Today, I'm joined by Dr. Chrissy. She is a chiropractor, a yoga instructor, and an orofacial myofunctional therapist at Joyful Body Barn and Elevate Airway, TMJ, and Sleep. Through her work with families, babies, children, and adults, she helps people better understand how their bodies function and how small changes can make a big impact on how you feel every day. Welcome, Dr. Chrissy.
Thank you. That was such a fun intro to listen to.
I'm looking forward to today's conversation with you, though. To kind of break the ice on today's conversation, why don't you share what's one thing you're looking forward to this summer when it comes to just your personal life as well as professionally?
Well, personally, I have started to get to exercise with my 14-year-old. So he's, getting me up early. We're getting out of the house and getting a little bit back into running and doing some cross training type of stuff. He's getting ready to be a freshman next year and he's doing a bunch with the Erie football team. So I'm excited to be motivated and also kind of bonding with him.
Yeah.
That's new. And whenever your teenager wants to hang out with you, it's like, okay, I will do that.
I gotta fit it in. We're doing it.
Professionally, I'm like remodeling the barn. We're adding a sauna and a cold plunge. And then I'm also finishing up my online course, The Joyful Jaw. So that, and I can touch base on it through the interview when it makes sense, but it's more of a home-based, do-it-yourself work that focuses on, alleviating tension and working on awareness and balance and coordination of your jaw on your own.
I love that. Those are great little extra now perks that you can provide to your clients. And even just having a sauna and the cold plunge, how fun.
I know. Part of it's for me because I love that stuff.
The perk is that I get to use it as well.
Yeah, but I am excited to have it. Probably have the cold plunge part be outside, and we have like a 5-acre property. So working on making kind of a pretty space for that too.
That's great. Awesome.
Yeah. Thank you.
Well, before we jump into like the meat and potatoes of today's conversation, I'd love for you to share a little bit about your story, how you got into chiropractic care. I know your own experience with chronic pain and healing really shaped your overall approach to wellness and patient care today.
Yeah. Well, growing up, I was always an active kid. And I got diagnosed with scoliosis when I was in 5th grade. And it was bad enough that they fit me for a full spine brace that I had to wear 20 hours a day. And I wore that until I stopped growing. I mean, there were different braces that I got as I went through until I was 15. And so I think with that, like, it's uncomfortable. It restricts your movement. And I fell in love with dance, partly because I got to take it off to dance. And so I danced every day. So I got super into dance, which I did through college. And I was on the dance line at University of Arizona and hurt my back. And I'd been afraid to go to chiropractors because my orthopedic, I think he was just old school and had discouraged me from going. And I was in so much pain. I was just like, I'm willing to try anything. I'm going to go. My friend loves this guy. And it just kind of blew me away, like how much it not only helped my acute pain I was experiencing at that point, but as I did a few visits, I could sleep better. I felt like I had better movement in my body. I could sit longer, which when you're a college student and a physiology degree, like you're sitting in an hour and a half, 2-hour class for things. And I think I didn't realize how much that underlying pain was there until it had started to alleviate. And I just had so much like joy come back into my body. And I shifted. I was going to be a dentist like my sister. And
Okay.
it was my junior year of college. And I was like, no, I'm going to do this. So that's
incredible.
How I got chiropractic. Yeah.
I love when there's that personal connection. And with so many of the wellness professionals that I've had on the podcast, there is that personal connection on how they got into what they're doing now, and being able to help people, like the people that they once were. So that's awesome.
Yeah. And I think for me, like the philosophy of chiropractic is get to the root of things, and is like, it comes from a place of the body is very intelligent. And it's doing things for a reason, and your body's not broken. It's just trying to communicate. And so I started to kind of adopt that into my life and lifestyle. So when I get sick or, anything that the body is experiencing, I don't look at it as like there's a problem with my body. I look at it as like, okay, body, you're telling me something. And I'm going to listen. I'm going to try to listen, right? Whether that's you need to slow down, you need to rest more. When it comes to the jaw, a lot of it is stress and tension and underlying airway issues. So there's nothing happening in your body that is not your body trying to work something through and communicate to you. Yeah.
Which is why we're also uniquely programmed, and like we all have different and unique needs too. Like our bodies are just all so different, but you gotta listen.
Yes. Very true.
So for someone hearing TMJ, and I've, depending on, of course, what's in your feed for social media, a lot of times it'll be popping up a lot. But what exactly is TMJ, and what are some symptoms or early warning signs people may not realize could be connected to it, like headaches, neck tension, use of sleep issues, or even like jaw clicking, which that's more of a physical, but.
Well, the TMJ itself is the temporomandibular joint, and it's basically where our lower jaw connects into our skull. Everybody has a TMJ, right? It's just a short version of saying what that joint is. When people say, I have TMJ, they usually mean like they have TMJ dysfunction, or they have pain or popping or clicking, or, it can create ear issues like a fullness feeling or pressure. Facial pain are some of the underlying things. You already mentioned headache, neck pain, shoulder tension, posture issues, like your head coming forward. Sometimes that's your body just trying to open up its airway. But when you pull forward, now all of a sudden your head's not aligned to your shoulders and it's twice as heavy. So then these are working twice as hard just to hold your head up all day. And that's if you're looking straight. If you're looking down at your computer, down at your kids, down at your phone, it's even heavier, right? So a lot of times if somebody's got jaw stuff, their shoulders all feel and they're just rock, or this is rock. And I'm like, even though you're not complaining of jaw issues, like you came to see me for your neck or your headaches, I'm going to work. Everybody that comes and sees me, I work on their jaw because I feel like it is a missing link of like the epicenter of a lot of stress and tension that we hold in our bodies.
How did you get into focusing on TMJ? So you went to chiropractic school. Did that just become a focus that you noticed, like that you felt like you needed to like learn more about, or how did you kind of open up that specialty?
A couple things. I mean, having a sister that's a dentist, and as she went through her own journey and learned more, and that kind of trickled down. But for me, working on the jaw started when I was a chiropractor at a birth center in Phoenix for many
Mm-hmm.
years, called Blossom Birth Center. Love them. And I worked with the lactation consultant. So as I was seeing a lot of babies, she would send them over, and I started working with a lot of like pre tongue tie release and post tongue tie releases, and working on the jaw and the neck, and working inside the mouth a little bit. So I learned at first more because I was doing pediatrics and infants that were having issues with latching. And so that got me interested in the tongue and the mouth and how it related to the jaw and the overall body tension.
Mm-hmm.
And then I wanted to get out of Phoenix because it is incredibly hot. And my sister was living in Denver, and she was like, hey, why don't you move to Colorado and we'll have like a dental wellness center? And I was like, okay, like I would love to come to Colorado. So that was a conversation we had in January of 2018, and I moved by June, my whole
Okay.
family. And then I worked, she at that time had a practice in Denver, and I worked together with her for 6 years. And she did a lot of functional bite work, and we both started to notice, you know, as she was moving teeth with like Invisalign or working on the bite, if this was popping, clicking, misaligned, deviating, if you didn't work on this first, you were aligning the teeth to the wrong alignment in the jaw. And so I started to really work a ton on everybody's jaw and kind of figuring out as I went, like the best ways to realign it, give them exercises to maintain it. And then I went through the orofacial myofunctional therapy certification. It was me and
Mm-hmm.
like 10 hygienists. And so
Mm-hmm.
it was fun because I feel like I got to bring like this whole body approach that the hygienists and even the person teaching the course was like, oh, you know, that's interesting. Like
Mm-hmm.
everybody that I'm working on their jaw, I'm working on their whole body. I'm never just working on their jaw, unless for some reason maybe they go to another chiropractor, or they're doing something and they want me to just work on the jaw. But in general, the tension pattern in the whole body matters, right?
Mm-hmm.
So if you just like people who specialize, and that's just the way our medical system is a lot, is like you go to a PT, you get diagnosed with TMJ dysfunction, and this is where they work. Maybe they work on your neck, but they're probably not working on your pelvis or
Mm-hmm.
you know, like, which is very tied to the jaw, right? And so I think I bring this, like, I did so much with prenatal and postpartum and pelvis work. And I started to work on the jaw as I learned more with all my pregnant patients, and they were able to release tension in such a different, beautiful way. And then, you know, working on the jaw, someone's coming with issues there. Like I almost always am like, I'm going to work on your hip flexors because, oh, yep, your right one's way tighter than the left one. Like it's all, you know, we're connected from top to
Mm-hmm.
bottom.
So for listeners in our community that
Mhm.
are seeing symptoms, like what are the different symptoms that you hear? And then they come in and you're like, actually, it's pain in your jaw, yes, but it's tied to something else. So what are you seeing?
I mean, I think the main one is probably headache, neck pain, fatigue, tension that you could get a massage and within an hour it's back.
Mm-hmm.
Like this chronic kind of low level tension. Some people will notice that like, oh, I can't open my mouth to eat a big sandwich, you know, or they'll notice some functional issue that is going into their day-to-day life. When I yawn, I have to like do it with a closed mouth. Otherwise it, you know, so there's very kind of obvious joint issues or TMJ dysfunction issues that people come in with. But then I also see people in the community that come for low back pain, and then they didn't even realize their jaw was so tight and clenched, and we work on both.
Okay. Why is the jaw like kind of like can be a central place, if that makes sense, like of why it's showing up in different areas.
Yeah. We use it so much, right? So to talk, to swallow, to eat, you're using it every day, all day long. And
Mm-hmm.
so it's a very overused muscle that you don't realize is an issue until it's an issue.
Mm-hmm.
But I think also like this is where we speak our truth. This is where we hold back and like clench.
Mm-hmm.
So I think there's some emotional things that really tie into piercing our lips, like different awareness that you can have. And even when I work with pregnant mamas and getting them prepped for babies, like part of what I teach them to do for labor is to relax their face. Like when you have pain somewhere else, you will often clench and tighten neck, shoulders, jaw, right? And
Mm-hmm.
so part of like labor prep for them is getting them the ability to relax their face, relax their shoulders, relax,
Mm-hmm. Mm-hmm. As you're
unclench.
talking, I'm like, okay, relax.
Let it go. As my 2-year-old loves to sing.
Let it go.
Yeah. I don't know if I fully answered your question, but yeah, I think it's just kind of an epicenter of communication to how we're doing, like where we're at.
Mm-hmm. Mm-hmm.
Mhm.
No, I mean, even you just talking, it's like thinking, I'm like, okay, as I kind of go throughout my day, like how much of my stored energy is like going into the jaw area and how
Yeah.
am I moving throughout my day? And,
Hmm.
how is my jaw kind of intertwined in that like flow,
Yeah. And then I feel like if you add anatomical things like the fact that you may have a tongue tie or that, um, with development or something, you have a narrow arch or crowded teeth, like your airway is small, and then your body is doing things to posturally to try to open that airway up. All of that can be going on underneath too. So I think a lot of people know that they'll clench and tighten or grind when they're stressed, and they'll
Mm-hmm.
say, oh, it's because I'm stressed out.
Mm-hmm.
But there is often, an underlying anatomical issue that needs to be addressed as well,
Right.
or a functional one,
Right.
how it's moving, how it's
Mm-hmm.
coordinating, if it's out of balance.
Not to like throw any professions under the bus, but like what are some like band-aid approaches that you're seeing where people aren't really addressing the root cause of what's going on with their
Yeah.
jaw and clenching, but it's just that's what people are getting prescribed because
I
they're
mean, I think the first thing that comes to mind is Botox is becoming a big thing to do into the jaw.
Mhm.
Um, and that is like the definition of a band-aid, I mean, it people, if your jaw is hurting, you're going to do what you can. And I have no like judgment of people that are looking for any kind of fix they can get because it really does affect your quality of life.
Mhm.
Um, but, even when I was taking the myofunctional certification, the dentist that taught that was really anti Botox because it doesn't, it can even mess up your movement and make that worse. And then as soon as it wears off, because it is a short term solution, like the issues might even be worse.
Mhm. Right, your muscles aren't getting worked like they normally should, so they're
Right.
just kind of in this fatigue state for a while, and then you're asking them to get
Yeah.
back to it.
Yeah. So it might work for a bit and then, it's like you have to keep doing it. So you're not getting to why it's tight,
Mhm.
is it misaligned? Is it, what is
Mhm.
going on? Yeah.
Mhm. What about mouth guards? I feel like that's kind of another common one.
I feel like most of the time, mouth guards, it's to protect your teeth because if you're clenching and grinding, you go to your dental cleaning and they're like, oh, your teeth are chipping, or you have gum recession, or you have this other stuff going on. Here's a
Mhm.
mouth guard that will, keep your teeth from breaking down. So it is a an important thing to have. But
Mhm.
again, if you have a small airway or you have issues with swallowing, or that's part of what your body is, the dysfunction is going on, you put a thing in your mouth, maybe you even breathe worse at night Like
Mm-hmm.
maybe your body's like, "Ugh, what is this foreign thing?" Because your tongue doesn't know where to go or it's not in the right position. And
Mm-hmm.
so I do have people who report that their jaw symptoms are worse with a night guard. That's not always the case, but it can
Mm-hmm.
be. And that's because it's throwing off it's like magnifying the issue.
Mm-hmm. It's
And
keeping you from
even
grinding at your teeth. Your teeth are safe,
yeah,
but the
it's
jaw
helping
is.
your enamel. But as far as the jaw,
Mhm.
it's not doing anything to help that.
We're going to take a quick break from today's episode to hear a word from one of our sponsors. Additional support for today's episode comes from Bridge Refill Market, Erie's local refill shop, helping families reduce waste one refill at a time. As of May 2026, the community has helped save over 28,440 containers from the landfill through refills at the shop. From laundry detergent and dish soap to organic bulk foods and personal care products, you can bring your own containers and refill only what you need. Learn more at bridgerefill.com. Now let's get back to today's conversation. As you were talking, I was also thinking, so like I will bite on my like cheeks and stuff. Like if I'm like
Uh,
bored or nervous, is that kind of a common sign of anything that has to do with the jaw stuff?
a lot, and I work with this. I would say a lot of my parents that are bringing kids in, they'll talk a lot because adults will hide it, right? Like you're biting your cheek, but probably nobody can tell.
Mm-hmm.
And that can be a sign that yeah, there's something's off that your body is trying to like let you know that something's off. So you get this like angsty feeling to like work on something.
Mm-hmm.
But with kids, it might be some thumb sucking or nail biting or hair biting or pulling or twirling or, there's these sort of oral fixation things that can happen. But also just overall kind of uncomfortable in your skin, um, which a kid is usually more obvious.
Mm-hmm.
Like adults have sort of figured out how to hide that, sometimes even to themselves. But a kid will be, like ants in their pants, or they'll have something going on that's more obvious to the parent. So they come in with like a weird habit that is a sign that there's something out of balance. And it could be their neck, it's not always their jaw, but
Mm-hmm.
it also could be their tongue or how they breathe or how they swallow. There's different, like when your tongue is where it should be, which is on the roof of your mouth. So if you put your kind of normal neutral posture for your jaw and tongue would be your lips are together, your tongue is on the roof of your mouth, not pushing on your teeth, but just behind your teeth, and your teeth are just slightly apart,
Mm-hmm.
right? Like that's sort of like a neutral position that your jaw and mouth should live in. And a
Mm-hmm.
lot of people, their tongue rests down on the roof of their, like down on the lower jaw. So then this has to like work to support the weight of your tongue, or it pushes on your teeth, which over time will narrow. If it's a kid, they're going to develop a more narrow, crowded bite, you
Mm-hmm.
know, because they're pushing forward, right? And
Mm-hmm.
so that will create this being narrow.
Okay. So can we talk a little bit about tongue posture, airway health, and myofunctional therapy? And can you explain how things like mouth breathing, tongue ties, bottle feeding, or the way we swallow can affect our jaw development over time?
Well, and I want to just say, like, I work with so many mamas and babies, and nursing is not something everybody gets to do for various reasons. And if you need a bottle feed, you need a bottle feed. So I
Mhm.
don't want to bring a lot of stress to families that like either have already done or are doing that for whatever reason they have. But the bite, and from a development standpoint, it's much smaller compared to nursing on a breast. So it creates a more like they don't have to work as hard, which can affect the jaw development not being as open or being as strong. If baby, or, if somebody has a tongue tie, you're working against this tight piece of tissue that's under your tongue that is like, for you to get your tongue to that normal neutral posture we talked about on the roof of your mouth, you're pulling against something, right? So it's going to be hard work. And that goes with also like nursing. It might not, they can't get it up to like compress the breast the way they're supposed to.
Mm-hmm.
And so it's so hard. They'll fall asleep at the breast, or they're really tired, or they won't empty it, right? So there's nursing and feeding issues that will show up because of a tongue tie. In my adults who have tongue ties, they maybe have had speech issues, or they have a lot of jaw tension because they have that anatomical piece that they're fighting against just to, talk or to rest. And a lot of times if your tongue is down, you'll end up having a little bit of an open mouth posture. Kids especially, you see it because they're not aware of it. And so they don't work to close their mouth. So you'll see a kid that's just like, it's slightly open all the time.
Mm-hmm.
And sometimes that is partly because they have a tongue tie, right? And it's keeping that tongue down. And then all the way that they swallow, the way that they breathe, all gets affected.
Mm-hmm.
And even the way that their face will develop, it'll end up being longer because this posture is open this way. Does that make sense?
Yeah. For listeners who don't really know exactly what myofacial therapy is, can you explain that? And like, who are good candidates for myofacial therapy?
So it's orofacial myofunctional therapy. And I mean, anybody that is listening and going, I have that. Or as a kid, I always was told if you snore, that's a big sign that there's something airway and there's some dynamic going on there. So that's a big, your partner's telling you snore, or if your kid is snoring. And another sign that you might be mouth breathing, you wake up and your mouth is dry. So, and sometimes your nose will be really plugged, or like you'll have to blow your nose in the morning, but you're not using it. So it's just like constricting down, or you drool. I know, like as a kid, I totally remember falling asleep in some class, which also, if you're just falling asleep in the middle of the day, you're not getting good rest. So I had fallen asleep and there was like a big puddle on my desk and I was mortified. Like nobody was catching that. But that
Mm-hmm. So what exactly does the therapy look like? What kind of like exercises are you doing?
I mean, if I'm working with a toddler or a little kid, it's super duper playful. And we might incorporate like licking a lollipop or putting some like jelly over here on your cheek, and you got to like get your tongue to like get over and get it. Or with an adult, feel free to do fun things like that too. But, it might just be swallowing exercises. So one exercise that I use is to smile with your teeth and then put your tongue up on the roof of your mouth, not touching your teeth, but on the roof, and then try to swallow. And if you move your head or you have like where it's hard, like you have to really think about it, like that is, you're probably using some of your muscles to help you swallow instead of your actual throat or your tongue the way it should press up on the roof of your mouth. So if that's difficult or challenging, like that's just an exercise you can start to do. Or to get your tongue up, like get your tongue up on the roof of your mouth and then try to open your mouth, right? And like stretch it under the tongue, but also it's making the tongue like kind of work against resistance to hold it up. So you're toning your tongue to get where it needs to be, and then you're working on the dynamics of how normal swallowing should happen. So it's kind of like a neuromuscular re-education, because when you swallow, you just do it automatically.
Right.
And so a lot of the exercises are like, you really have to like think about them. because it's not that they're hard. It's just that they're going to feel very foreign if you've been doing it wrong your whole life.
Mm-hmm. I know people don't teach you how to.
And I didn't learn any of this in chiropractic school.
Mm-hmm.
Like I learned the tongue is innervated by this particular nerve, like that was, but like I didn't learn anything about how, someone coming in with neck and headaches and forward head posture, that you should look at their airway or their tongue, or like that was not something that was taught at all in school for chiropractic.
It's so fascinating how everything,
Mhm.
but it's something we use literally every minute of, or,
Yes.
it's something we're constantly utilizing every single day. So
Yeah.
making sure that it's working properly and that the muscles are toned correctly, all of the things is so important, it sounds like.
Mhm. Yeah. And I think the awareness is growing.
Mm-hmm. So do most people that do the therapy, do most of them need like a tongue and lip tie release?
I wouldn't necessarily say most. I don't know, maybe it's 50%.
Mm-hmm.
But you can, with the exercises, a lot of times what I'll do is we'll do a few weeks of exercises. And every time someone's coming to do this type of therapy, there's things that I'm measuring, right? I'm measuring their jaw, how far they can open. I'm measuring if you put your tongue up on the roof of your mouth, how far can you open? I'm measuring your upper lip, because this is also something that we work on stretching. If it's small and kind of pierced, you need to elongate through there, which makes it easier to have a good lip seal. So there's things that I'm measuring every time. And so I want to see those things, A, be in normal range, and B, start to change. And sometimes just with the therapy, if they were borderline on the tongue tie piece, sometimes with the therapy, they can avoid needing the actual surgical release. And sometimes it's really obvious that they can't, that
Right. You're restricted at some point where you can't move any.
Yes. Like we're working against, no matter how hard you try to do this particular exercise, you're not going to be able to. So the nice thing about doing a little bit of the therapy before is they really get to feel what it feels like to work against that restriction. And then when they get it released, it's like, oh my gosh, that is so much easier. That is so much better. And a lot of times it even, people report having their neck and shoulders and their head, like everything feels lighter, looser. So it's not just the jaw.
Okay. What are some of the benefits that you're going to see your child be able to play sports easier? Like just things like that as they get older.
I mean, just from like a oral issue, I know a lot of kids who have trouble keeping their mouth guard in. So there's a lot of sports where you have to wear a mouth guard. This is a small thing, but it's a sign that there's an issue. They can't breathe when that's in. Right? Like they're spitting it out. They're getting penalties because they're not putting it in, or they're just messing with it. Like I think when things are aligned and relaxed and their nervous system's in a better place and their oxygenation is in a better place and their sleep is in a better place, it's like all the things improve. Like all the things, just how they feel, their attitude can improve. Right? Like if you're tired chronically, you're just agitated. You're more on edge. Right? And so between the body work, working on their functional bite, getting it to where it needs to be, working on airway, that helping their sleep, breathing during sports. I mean, and pretty much all sports require some kind of cardiovascular piece to them. So if you're breathing better and oxygenating better and your posture's better, like that's going to have a big trickle down effect to just something you're not fighting against. Like it's not that you can't be a good athlete. I was a good athlete, even though I was tongue tied, but I feel like I had to work harder to be naturally as good as someone else who didn't have those issues.
Right. Yeah. It's like, at what level could you perform if your body was in just more of, I keep using the word flow state, but it kind of is like, you're just like naturally in this like great flow
Yeah.
of like mind body connection, all the things. So
Right. I like the word ease too, like balance
mhm,
and ease. Like
mhm,
when you're at ease and not fighting against some tension pattern,
mhm,
that just feels really good, feels really
right,
different.
right. For someone listening who feels like this conversation connected a lot of the dots for them or maybe a family member, how can people work with you, and what are the different places people can find you or connect with you in our community?
If you're relating to this or you feel like we're describing your spouse or your child,
Mhm.
I have a home practice, Joyful Body Barn. It is here in Erie, um, where I do hands-on work, chiropractic and the myofunctional therapy. So they can contact me, joyfulbodybarn.com, check it out there. I also work with my sister at our Elevate Airway TMJ Sleep Center, which
Mhm.
is in Westminster. It's really great to incorporate that because there's imaging. We're going to look at a 3D image of the way your bike comes together. So it really like rules in or rules out a lot of things that can be helped with some of the orthodontic work or the tongue tie. So that is also a really great place for people to start. And then the Joyful Jaw program that I'm working to do for people online. It's a great adjunct. Sometimes you need more. You can't do everything on your own, but there's a lot of nervous system relaxation that I teach. So I'm certified in heart math. So that is basically like a biofeedback type of meditation where you learn to regulate your nervous system, your breath, and you're looking at your heart rate as a marker. So there's some like tangible things that you can tell that are improving with that type of meditation and biofeedback. And then
Mhm.
there's just stress management tools, which a lot of it is awareness of where you're gripping or where you're tightening in your body or where your thoughts create tension. So I work with that on the Joyful Jaw program, as well as teaching people when I watch videos about how to like assess their own alignment, work on some self massage techniques. And I do that also as an adjunct if someone was coming to see me for body work, but I felt like they could really use taking a deep dive. That's part of why I'm creating the online program so that they can work on it on their own at home, on their own pace, do
Mhm.
the parts they like, um, and kind of maintain the work or take it even deeper by doing some of that work for at home.
Mhm.
I teach coming up here in June. I'm starting to teach a prenatal yoga class as well as a postpartum mom and baby class at our new local Erie yoga studio,
Mhm.
Mindful Yoga and Wellness, right there
Okay.
next to Fox Dog in downtown. So I'm super
Mhm.
excited to get back to that. I haven't taught yoga for a little while, but I'm excited to get to work with that population. With the prenatal classes, it is a lot of community building as well, where moms get to meet other moms that are pregnant, and there's a little more incorporation of like themes and sharing different things that are going on for them. So you've got the yoga that's strengthening and working on relaxation. And then you have meeting other moms in the community that are kind of in your same stage,
Okay.
which is cool.
Awesome. Well, you're kind of just dabbling in, I love you're doing the online stuff so you can hit more people because there's only so many hours in a day, right? So many appointments you
Yes.
can have. But you still have your home base and now you're doing things out in the community, which is great too. So
Yeah. And I love our community. So I'm excited to get to work here and grow here.
well, Dr. Chrissy, thank you so much for joining us today and for sharing your knowledge and passion for helping people better understand the connection between their jaw function, breathing, airway health, and overall wellness. If you'd like to learn more about Dr. Chrissy, Joyful Body Barn, or Elevate Airway, be sure to check out the links in today's show notes. And as always, if you enjoyed the episode, please share it with a friend, leave a review, or subscribe so you don't miss an upcoming episode with some of the incredible local businesses that we have here in our community. Thanks again, Dr. Chrissy.
Yeah, thanks, Lauren. My pleasure.
All right, friends, before we wrap up, here's the part I need to share. This podcast is for educational and inspirational purposes only. I'm just your friend behind the mic. Nothing shared on this podcast creates a patient relationship with any of our guests or replaces the guidance of your physician, professional coach, or other qualified expert. And the views shared by guests are entirely their own and don't necessarily reflect the beliefs or values of the Erie Wellness Podcast. My goal is to simply create a space for real, open conversations that help us all learn, grow, and feel a little more connected on our wellness journeys. Thanks so much for listening. I'll see you back here next time.